My name is Dr. Bronwyn Storoschuk. I'm one of the naturopaths that works out of the Conceive Health location in the downtown Trio location. For those of you who aren't familiar with Conceive Health, we're a preconception care clinic, a team of naturopaths and acupuncturists, and we've got locations all over, but I'm super fortunate to work out of the Trio Fertility location downtown, supporting patients who are also patients at Trio. And so we've got a very collaborative approach between the medical doctors and REIs at Trio and the naturopaths at Conceive. I'm very passionate about metabolic health and how we can really optimize your health and your body for conception to not only get you pregnant and have a healthy pregnancy, but to really give these offspring the best chance at a healthy life as well. And so this type of medicine in my eyes is the best form of preventative medicine, and we're working through those intergenerational kind of steps there. And so really excited to talk about this topic with you all today.
And I'm Kristi. I'm fortunate to be Bronwyn's little sister. I am finishing up my PhD at Queen's University in exercise physiology, and I study metabolism, how we adapt to exercise and nutritional interventions around exercise training, and metabolic health. So I study a lot of glycemic control. And I'm really excited to be here and dig into this topic because, as Bronwyn said, I echo what her sentiment on her passion for metabolic health and the intergenerational at any stage of a woman's life. Intervening and improving our metabolic health is extremely impactful no matter what stage of life we're in, but preconception care, especially to just ensure that future generations are supported. So we're really excited to be here, and we're extremely passionate about this topic. And so just to kick it off, let's define metabolic health. It's kind of this broad term that gets thrown around, but we shouldn't take it for granted of what it means. So our metabolic health really encompasses our metabolism. So how well our metabolism is functioning, and that means how we're utilizing the energy in the food that we eat and the energy that's stored in our body, and where that's going in our body. So our metabolism, we're really thinking about carbohydrates and fats as our main sources of fuel. So how well our body can utilize carbohydrates and how well we can utilize fats. And at appropriate times, depending on the circumstances. And our metabolism is extremely dependent on our body composition, how active we are, so how much muscle mass we have, how much body fat we carry, how much we move throughout the day, what our exercise routine is, and then, of course, our diet. So we can really impact our metabolic health through lifestyle interventions and our daily habits.
And I think that's such a good explanation of metabolic health. And then you might be asking, like, why does that matter for reproductive health and fertility? And it is so interesting because when you're in a state of, we'll say, metabolic dysfunction, or you have poor metabolic health, like you're not utilizing that fuel well, we start to see these downstream effects, and those effects impact our reproductive function directly. And so we see things like inflammation. We see things like changes to our vasculature, our cardiovascular system. We see insulin resistance, which we know can have direct impact on the quality of our eggs, the development of our placenta. We see things like hypertension, so high blood pressure. We know that if there's high blood pressure before getting pregnant, you're at an increased risk of things like preeclampsia in pregnancy. And when we have high blood pressure in pregnancy, it can be a very serious concern. And so the changes inside our body when we have poor metabolic health have a direct tie to our fertility and our reproductive function. And so that's why it's so important. And that's why the two of us work so well together. Kristi, really studying metabolic health. And then, from my clinical experience, tying those two together and really being able to speak to the whole picture of metabolic health and fertility at the same time.
Yeah, exactly. I was thinking about this today, conceptualizing like our metabolism and then fertility, and we're really creating a home for our future baby. So, and our metabolism is really dictating that home. So I think connecting it that way makes sense.
Yeah. And if you're, asking yourself, what is my metabolic health? Like how do I get this type of assessment? You've probably actually measured a lot of different markers of your own metabolic health at various points in your life. And so think things like your fasting blood sugar level, your fasting insulin level. This may or may not be something that you've had done. Your blood pressure. This could also be, one marker is your weight. We calculate your weight and your height to get your BMI, and BMI is one marker of metabolic health. Your waist to hip circumference, your cholesterol levels. These are all pieces that build the understanding of your metabolic health, or the way we would assess your metabolic health. Other things are like your hemoglobin A1C, your body fat percentage. So Kristi said, like, the biggest understanding of your metabolic health, or how we can understand it, is looking at your body fat and your muscle mass. That's the best indicator of your metabolic health. And so looking at things like your body fat percentage can help us understand a little bit more about your metabolism. Are there supplements for metabolic health? Yes, there's supplements that can possibly enhance your metabolic function, but there will never be anything as powerful as good nutrition and, supportive exercise and just general movement. There are certain supplements we use in the clinic for people who have things like insulin resistance, for example. Depending on your unique metabolic health or your metabolic status, there may be something that could help you. But even if we talk about certain nutrients, B vitamins, that's in some sense related to your metabolic health and your metabolic function, because we're talking about the function of so many different cells. And so supplements may help with attaining better metabolic health. But like I said, it will never replace things like exercise and nutrition. And if we're actually trying to elicit big change, exercise and nutrition are going to be way more powerful.
Yep, I agree.
If I am on thyroid medication for hypothyroidism, is my metabolic health slower? Do you want to talk about anything there?
I'm really not familiar with thyroid medication.
Yeah. So hypothyroidism is a state of a slower metabolic function. So we see things like excess weight gain, we see slow digestive function, even slower movement. So it is that state of just kind of everything is a little bit more sluggish, and our metabolic rate may also be lower. If you're on thyroid medication, the idea is that you're replacing those hormones so that you're not impacted by a slow thyroid. And so it's so important to measure your TSH, or thyroid stimulating hormone, and maybe other thyroid blood tests that we can do before you get pregnant. And that's why if you are at Trio, or if you've worked with any preconception care team, you've likely had your thyroid assessed before getting pregnant. And this is just, again, really emphasizing how important it is to address our metabolic function from every aspect before conception. And so you wouldn't be at any increased risk if you're on the thyroid medication and you're adequately supporting your thyroid health.
And I don't think if there is any effect of hypothyroid or thyroid medications, it's not something that wouldn't be able to be overcome through lifestyles and behavior change.
Mm-hmm. We'll talk a little bit more about a program that Kristi and I are running, but we had a couple patients who have been in the program with us who have had hypothyroidism, and they've done great in terms of weight loss as well. Does age affect metabolic health? Kristi, I'll let you take it.
Question. This is up for scientific debate. There's a lot of controversy within the field, but the real argument is our metabolism slowing as we get old, or are we just not moving as much as we start aging? When we look at the health of long-term athletes who continue their exercise routines into older age, they actually look just as good and as fit as younger individuals. There is some inherent changes with age, but again, it's kind of what I just said. It's like it's something we can overcome by adopting a regular exercise routine and just protecting our metabolism as we get older. Again, just echoing, and nothing is as powerful as good nutrition and a regular exercise routine to not only reverse some changes that we would want to see in our metabolic health if we're if we're looking to improve our insulin sensitivity, reduce our blood pressure, reduce our waist circumference, these markers of our metabolic health, we can use diet and exercise to do that, but we can also use diet and nutrition to prevent any declines as we age as well. So yes, I would say age does affect, but we have tools in our toolbox that we can basically slow that decline.
And I think that we overestimate how much age impacts our metabolic health. And I think people use it as an excuse a lot of the times, like, oh, well, I'm a little chubbier, but I'm older, so it all makes sense. But I think we've taken that at face value, and like people have started to use age as an excuse where we don't necessarily always see we don't see weight gain in the people who have maintained those routines, like you're saying, Kristi. It's that as we age, we sit more and we move less, and we start to adopt habits that don't necessarily support our metabolic health. And if you're not supporting your metabolic health, you are in fact declining and getting poorer metabolic health. It's something you always have to be working on. We do sit a lot in a lot of the jobs that we have these days, and that's working against us. So that's correlated with age. And so now we say that age, it maybe makes our metabolism slower, or we have worsened metabolic health. That one irks me sometimes, for sure.
Oh, that's a good point.
What is a good BMI for someone trying to conceive in their mid-30s? BMI, first of all, I just want to say it's not the most perfect tool when we're assessing our metabolic health, and body composition would take that one step further, but BMI is heavily used in the research, and so we know that there's a lot of validity there. We want people in a normal BMI category. That's where we see the best reproductive outcomes, and so that's talking between, let's say, 20-25-ish. Anything over like 24.9 puts you into that overweight category. And that's when we start to see your weight impact your reproductive potential. We also don't want a BMI too low. So having too low of a BMI has also been tied to things like poor reproductive function and worse outcomes with things like, say, IVF. There's so many good questions here. Thank you guys for
awesome.
asking
Oh my gosh.
a lot. How big of a risk factor is age versus metabolic health? So I think we kind of answered that.
On fertility, I guess.
On fertility, how big of a
I'm assuming
risk factor is age versus metabolic health? If we're comparing age and metabolic health to fertility, I mean, like to your fertility potential, age is definitely the most strongly correlated measurement. So as we age, we know that egg quality declines. We know that reproductive function declines. Are some aspects of that related to metabolic health? There's no way I could say no, for sure. There's it's definitely an association. It's just, age as an independent factor is definitely the strongest associated factor that we have.
Yeah, I wouldn't necessarily compare those two, because I would be, no matter what your age, we should be concerned about our making sure metabolic health is in place pre-conception.
How much should you exercise while trying to conceive?
It's a good question. And there's no real concrete answer to that question, because it really depends on someone's baseline starting. So anything is going to be better than nothing. If you're someone who has not exercised and has no routine around exercise, a simple daily 30-minute walk is going to make a difference. For someone who already walks every single day, perhaps even just like picking up the speed between like street lights, for example, doing little bouts of higher intensity has been shown to improve things like glycemic control, running up the stairs. So little things like that, those things make a difference depending on someone's baseline. So if you're someone who already is pretty active during the day, then that's where we would think about how to take a step further. So incorporating structured exercise into your day, whether that's aerobic or resistance training, so strength training, and then spreading that throughout the week. So at least 2 strength training sessions a week that are structured deliberately, going into it with the intention of building muscle, but then also supporting our cardiovascular health and our glycemic control through aerobic exercise. So making sure we're getting our heart rate up and we're huffing and puffing and sweating. Those signs that's a really good sign that you're telling your muscles to adapt. So again, coming back to our metabolic health is really dictated by our muscle health. And the more we're promoting adaptations in our muscle, like we're telling our muscles that we need to get bigger, better, and stronger, that uncomfortable feelings, whether it's huffing and puffing or lifting heavy, and making you feel uncomfortable, those are really good signs that you're improving your metabolic health through what you're doing in exercise. So to really bring that back to how much exercise, it really depends on where you're starting, because someone could be exercising potentially too much. That's creating too much stress in that person. We'd want to bring it back down. But to start, I would say the physical activity guidelines are actually a really well established recommendation. So at least 150 to 300 minutes of aerobic exercise, so vigorous to moderate to vigorous exercise, and then at least 2 strength training sessions a week. That applies across the board, and there's a lot of science to support why those are the weekly recommendations. So that, I would say, that is like a good starting point, and then individualizing it from there.
And I think part of that individualization is, what's your goal too with exercise? We all need to exercise. So it's not about, do you exercise or do you not? But if you are in the obese BMI category, for example, we know that weight loss is going to increase your chances of conceiving. And so we may need to be a bit more strategic about how much you exercise compared to someone who may be very lean trying to conceive. We may not want them to overdo certain things. And it all comes back to, what are you eating at the same time? Like, we can't just look at exercise. But I think a lot of the population who's trying to conceive sometimes actually just goes too far on one end of the spectrum, whether they're trying to be too active to get pregnant or actually not active enough. And so I think, just as you've said, Kristi, when I work with my patients, I am using those Health Canada guidelines because I think they are really great, as long as you've had, your individualized assessment made and, you're good with that level of exercise. There are some really good studies that have looked at just the amount of physical activity and fertility. And so just one here, this was a meta-analysis, and the takeaway was that higher levels of physical activity were associated positively with the number of retrieved eggs from an IVF cycle, pregnancy outcomes, and live birth rates. I don't actually have the number of physical activity minutes that they were talking about, but the people that were actually on the higher end of the spectrum had better outcomes from their IVF cycle. As a person with PCOS and very insulin resistant, it takes very long to lose weight. Do you have any tips here? That's number one. Number two is, do people like me need to use GLP-1, so medications like Ozempic, etc., to see meaningful results? Weight loss is possible if you're insulin resistant. If you are, very overweight, like, there are strategies that need to be put into place to help with your weight loss. And probably mostly the strategy is accountability and, someone cheering you on, because it's hard work. That's definitely no lie. Even if you're insulin resistant, you can definitely lose weight and get to a healthier weight. And as you lose weight, you're going to have an easier and easier time, because you will be less insulin resistant in most cases if you're losing a healthy amount of weight. I don't know, Kristi, if you want to address anything there.
And you just need to have the right tools in place.
Whether somebody's insulin resistant or not, we're still always focusing on building lean muscle mass. If you are insulin resistant, muscle mass is so important, because your muscle can actually take in blood sugar without insulin with muscular contraction. So exercise is an independent pathway for, balancing your blood sugar. So for example, when my patients are insulin resistant, we always talk about utilizing postprandial walks. So after you eat, going for a walk, because that movement of your muscle is going to help get the blood sugar regulated without needing as much insulin. And so there's simple strategies like that. And again, it's always an individualized approach, but exercise is going to be the most important thing to reduce your insulin resistance and really get you more sensitive to that.
I was just thinking about the studies where even independent of weight loss, if you just exercise
Right.
more, you improve your insulin sensitivity.
Right. So you don't even need to lose weight. Yeah. The second part of that question was, do you need to use GLP-1 agonists? Could it be beneficial for you? It depends. It depends, when is your cycle? How much weight should you be losing to get you into a better metabolic status? Could it be a useful tool for you? Maybe. We're definitely seeing these tools being used more and more in the reproductive health world and fertility world. They have good utility for some people, but for others, it's probably not the best first line approach. No matter if you're going to start a GLP-1 agonist or not, you still need to focus on lean muscle mass through exercise and proper nutrition, because as soon as you come off, we know that the weight regain can be quite drastic. And also the loss of muscle mass can be significant as well. I hope that answered your question enough. It's hard when it's very individualized. Okay, what are some superfoods to increase fertility and or increase metabolism?
All I'm thinking of is liver, nutrient dense organ meats.
Yeah.
But those are not necessarily palatable or approachable by many people, but it's true. They're very nutrient dense.
So we are talking about things that are going to be, as packed with nutrition as possible as a fertility superfood. And the ones Kristi's listing are, more animal based in general, and they have a lot of those fertility, the nutrients needed for preconception. So we're thinking zinc and iron and B12 and macronutrients like protein. These are really, really important for fertility. And so highly nutrient dense foods, whole foods are going to be in that category for the most part. Lots of brightly colored, fruits and vegetables, and lots of lean proteins. Those are all superfoods.
Omegas.
Yeah, fatty fish.
Eggs, the cold.
And so if these foods are giving you the nutrients to support fertility, let's say like from an egg quality perspective or a lining development, these are also supporting your metabolism, just because we also need these vitamins and nutrients for all of our cells to function at their best. And if we're also talking about using exercise to enhance your metabolism or to get you into a better metabolic state, you need those nutrients maybe even at a higher level because you're just doing more with your body. So superfoods are important at all times, but for fertility, of course, as well. What are the types of food we should include in our daily food or diet, I guess, to increase our metabolic health?
Yeah, I think it comes back to like, how are we supporting our body composition? And that's how our food choices are kind of dictated. And so if we are overweight and we want to improve our body composition for the sake of improving our reproductive function, fertility, we'd want to reduce body fat while either maintaining or growing our muscle mass. And we can do that we can change our dietary choices to support that. So Bronwyn and I are big advocates of a whole foods diet and a higher protein diet. And that way by choosing whole foods, we're reducing the chance of overeating. If we need to reduce body weight and body fat, then we're supporting a potential energy deficit that's going to help us lose weight. But that protein intake is really important for making sure we're supporting our lean mass all while losing weight. Because if we haphazardly try and just cut calories and eat less without focusing on protein intake, we do run the risk of losing too much muscle mass. And that is going to be counterproductive if we're trying to improve our metabolic health and also just long-term sustaining our weight loss. If we're better able at keeping the weight off, the more muscle mass we have after weight loss. So we can change our dietary choices and incorporating protein at every meal, a certain protein prescription based on your body weight and your body composition, and then choosing whole foods and making sure that we're not eating those calorically dense, hyperpalatable processed foods that are really easy to overeat. They override our appetite. We can't really control our intake around them. Reducing those or completely removing them and removing things like sugar sweetened beverages or just caloric beverages in general. Things you can consume very quickly, rapidly, you can't control your intake around. Those are what's going to negatively and deleteriously impact your metabolic health. And we want to remove those foods so that we're trying to better support our body composition through our nutritional choices, through something like whole foods and a higher protein diet.
Mm-hmm. And I have a couple things to add to that because it's so interesting. The research that looks at just lowering your caloric intake to lose weight, so successfully losing weight, but through just diet alone, we actually don't see an improvement in your fertility in most people. But when we pair exercise with a hypocaloric diet, so we're supporting your lean muscle mass, we actually see an improvement in things like what we talked about earlier, like oocyte retrievals, like the amount of eggs you can retrieve, live birth rate. So it's quite interesting to look at just the low calorie diet weight loss studies versus more of those like lifestyle and holistic plans where we are looking at more than just lowering the amount of food we eat.
And another thing I want to add is that like why we are big advocates for whole foods too is that we can cover a nutritional basis without really having to really think about it, because whole foods are generally more nutrient dense than packaged processed foods. So it kind of removes that cognitive burden of food choice and having to really figure out what we're eating for certain nutrients and stuff like that. So if we just create that general base of our diet, then it removes so much like choices around our food and ensures that we're getting things inherently just by having those in place.
Mm-hmm. And just to be really clear, when we're talking about whole foods, we're talking about fruits, vegetables, meats, grains. Dairy's kind of like there's an asterisk beside it because technically it's processed, but it's still, regarded as a whole food by most circles. And processed or ultra processed foods, we're talking about things like cereals, crackers, breads, like things that clearly are not found that way in nature. And as Kristi was saying, like those foods, they're delicious, they're hyper palatable. We love them and we eat so much of them that it can have a huge impact on a daily basis on our metabolic health. And so for some people, they need to remove those altogether because they can't do moderation. And other people can, maybe have a little bit and be okay with it. But it depends on the person. But overall, those foods are never going to be supporting your metabolic health. Okay. What tests can check your metabolic health when planning for pregnancy? So these are really simple things for the most part, blood tests. So on my patients, I'll run things like hemoglobin A1C, fasting blood sugar, fasting insulin, postprandial. So after some form of food ingestion, your insulin and your glucose to see your blood sugar, to see how you respond to a certain amount of carbohydrates. A cholesterol panel or lipid panel where we're looking at things like your good cholesterol, your bad cholesterol, your triglycerides, inflammatory markers, so we can run that in blood work. These are all things that I think are really important to have run like today if you're trying to conceive, because the more information we have, the better we can support you. And also some of these things take time to alter. And so it's important to know where you're at in terms of your metabolic health and all of these markers. Are there different ones for men and women? No, like for women and men, of course, we're going to look at other things. We'll look at your hormones and everything, and we take them, we interpret them differently. But from a metabolic health standpoint, the testing wouldn't be any different. I know we're getting close for time. So if you are thinking of any questions, please put them all in now. We'll try our best to get through all of these here. What? Rapid fire. What types of exercises help enhance metabolic health? So Kristi kind of already talked about this. Like anything is helping you support your metabolic health. Movement in general, muscle contraction. However, we really do want to focus on lean muscle mass production, or like building or maintaining your muscle mass. So that's resistance training. And that doesn't mean you have to go get a barbell and go to a CrossFit gym. It can be dumbbells, it can be any form of resistance. But as you get stronger, you always want to continue to grow with your exercises as well. And so it should be challenging. You should be lifting heavy things, and you should be doing full body type exercise.
And I'm just going to kill two birds with one stone, because there's a question: is lifting heavy with less reps better for building muscle, or lifting moderate weights with more reps? But if you're looking at strictly strength, then lifting heavier for less reps is going to improve your strength. But for the purpose of hypertrophy or growing muscle, gaining muscle, you can do either or. But also the difference in strength is probably so small that I would just go with what you prefer.
Mm-hmm. For most people, we don't need to get into like even the nuances of exercise. And really it is just like full body work, giving it your all, like Kristi said, 150 to 300 minutes a week, and you're going to, succeed and really support your metabolic function. Somebody asked here, should I focus on losing fat or gaining muscle? Good question.
I think by focusing on gaining muscle, you're going to inadvertently be losing fat as well. Especially if you're pairing it with a diet. So Braun and I don't like to think of, is it like diet or exercise? It's diet and exercise. These two they complement each other, and we can utilize both of them to get to our goals quicker. So of course, if you're going to be lifting, gaining muscle, but then you're not focusing on your diet at all, then we have room for improvement there. So I would focus on gaining muscle, because that's the organ we're trying to improve our metabolism. And then inadvertently, we hope that we have our things in place to lose the body fat as well.
Yeah. And I think by focusing on building lean muscle mass, there's so much that happens in your body that even like appetite regulation. So if you're focusing on exercise and building lean body mass, maybe you'll naturally reduce your appetite, or, your body just gets super aware of what you're doing, and you may naturally eat less calories, which may help you burn fat at the same time. Because really, when we're talking about losing fat, we're talking about your caloric restriction, or reducing how much food you're eating. And when we're talking about building muscle mass, we're really talking about exercise. And then, of course, supporting that with protein. Any recommendations when you are on a plant-based diet?
Yeah, I mean, there's certainly foods that you'd want to include, and supplements as well. So having a good plant-based protein supplement, and then also including whatever plant-based protein sources you can in your diet, would be important, so that you're not just kind of relying on carbohydrate, because a lot of plant-based foods are just high in carbohydrates. So making sure you're focusing on protein in a way that is in alignment with your plant-based diet. So that might require a protein supplement. We would want like a B12 supplement as well, and potentially other things related to fertility and fetal development as well, that you're not getting from an animal-based diet or an omnivorous diet. So yeah, like B12, all the B vitamins, omega, an algae-based omega would be important as well. But for the sake of body composition, it would be trying to focus on those high protein plant-based foods. So something like tofu, tempeh, protein powder would probably be your standard go-tos.
Someone wrote here, I've been debating joining the metabolic program. Can you share more about the time and day of the week that the group coaching sessions will take place? And so I think this is a good question to just get into the metabolic program a little bit too, because it will answer a lot of these other questions. So if some of you don't know, Kristi and myself are the co-facilitators of the metabolic program at Conceive Health, and we have our next cohort launching September 30th. This program is designed to support your metabolic function for those trying to conceive, to really give you the best shot at, we'll say easy conception, or the easiest conception possible, a healthy pregnancy, healthy postpartum recovery, and giving your offspring that healthiest first start at their life and long-term health. And so we've thoughtfully built this 12-week program to be there to hold your hand and to hold you accountable to all of these things we've been talking about. So it's a nutrition plan, it's an exercise plan, and the goal is made on an individualized basis. So there is some one-on-one work that we do to really understand what's your goal. What do you need to do to change your body composition? And we will do the assessments to understand where you're at. So blood work and a body composition analysis. And then we have a group do this together. And so it's been really fun to run. And we've seen some tremendous success with some of the people who've gone through the program. There are 3 group calls. And so the first one is the onboarding call, which would be September 25th. The next one I want to say is October 18th. I can pull up these dates because that was the question, share more about the date and time. So the group calls will be on Wednesdays at September 25th, October 23rd, and December 18th. The calls where we all show up together. There's also, built-in community. There's daily progress reports where myself or Kristi will be, analyzing your tracking sheets and really making sure that you're making the progress that we expect. And if not, troubleshooting with you.
We will adjust things each week and give you feedback on a weekly basis.
Someone just asked how much is the program. So the total cost of the program is $1,750. There's an upfront cost of $525, and then potentially blood work on top of that. It depends if you're a true patient or not. And then the program is billed throughout the 12 weeks. So $200 5 times throughout. And that's so that you can get some covered by any extended health benefits that you may have for naturopathic medicine. And so those will be billed as naturopathic visits, and you will be eligible to submit it anyways to your insurance provider. So if you have naturopathic coverage, some of the program should be covered. How much protein do you need to eat to gain muscle?
So Bron and I typically prescribe at least 1.6 grams per kilogram of body weight per day. So it is based on it's a reference range for that, for an individual, or I guess a relative amount per person. So it depends on your body composition or your ideal body weight. So if you are looking to lose weight, you would base your protein intake off of your ideal body weight, what you want to weigh. And that's 1.6 grams per kilogram. And then you can kind of play around with it from there, but that's our starting basis.
I want to also be mindful of time, but let's answer a few more questions here. Somebody asked, what's the relationship between stress and metabolic health? So, we do know that stress has an impact on metabolic health. I'd say like stress and sleep are the other 2 really important factors to be addressing in addition to nutrition and exercise. If you are in this chronically elevated stress response, your body is in a different state. And so we do want to make sure that we're supporting stress management when we're optimizing metabolic health. Is there anything you want to add? There's so many reasons to it. So it's like I could talk about it for a whole hour on its own, but definitely has an impact. Lots of great questions here. Thank you so much. What if someone is underweight or has a low BMI while trying to conceive? We touched on that a little bit. This is something that we do see is negatively associated with fertility outcomes. And so it's important for us to focus on how do we gain weight in a really healthy way too. And that's probably really focusing again on some lean body mass, maybe even a little bit of body fat. So for females, we do want to have a certain amount of body fat. I want to say it's something like 18 to 28% body fat is that ideal range for having healthy hormone signaling, which of course is going to have a direct impact on your fertility potential. There's a couple questions here that are just difficult to answer because they're very individualized and not necessarily associated with metabolic health. I just want to put it out there that we have complimentary discovery calls at Conceive, and Trio has this as well. But if you want to discuss more specific health concerns of yours, or whether it's failed IVF cycles, or you've tried it all, there's nothing more to do, that's something that we can always get on a call with to decide if it would be best to, maybe join a program like we're talking about with a metabolic program, or work one-on-one with a naturopath or some other health practitioner. So just want to put that out there because there are a couple questions that might be a little bit too challenging to answer here. How many clients are expected to be in the metabolic program? So, I mean, it could be a range. It could be, anywhere between 8 and 15 people potentially. It depends on the demand at the time. Okay, maybe we'll do one more. This is program specific. How can the metabolic health program be adjusted if you conceive while in the program? I'm interested in joining, and during the program, we'll also be doing cycles of IUI. So yes, there are people who do conceive in the program, and that's amazing. We will be there to cheer you on and be super excited for you, and we'll also offer modifications if necessary. In early pregnancy, it all depends on the person and depends on how you're getting pregnant. But in early pregnancy, there's actually not a ton of modifications that are absolutely necessary, but we will assess that on a one-on-one basis. And so if there's anything that needs to be changed, we will change that with you. From a nutrition standpoint, nothing needs to change through pregnancy. You may just feel a little bit off through that first trimester. And so we'll do the best we can to support you so that you can continue to eat a whole foods, high protein diet. And that's going to give you an amazing opportunity through pregnancy to support good fetal development, and also really be supporting your own health throughout when you're postpartum. And when we finally meet that beautiful baby, you're both in the best health you can be at that point in your life. Okay, what do you think? What's the cutoff date to register? Honestly, as soon as possible. It starts next week. That's our onboarding call. And so if you're interested, we will be sending out a note tomorrow with some extra information for you. And we will include the link for where you can find more information about the program, and also what your next steps would be if you are interested. The first step is having a free call with myself just to do an assessment and make sure it's a good fit for you. So if you have a lot of questions, you can book in for one of those. Okay. I think that's all we can do tonight.